sits on one of the greatest economic engines in modern history. With nearly 70% of its citizens in the working-age population, the country has a massive labor force ready to drive decades of global growth. Economists call this a demographic dividend. It happens when a nation's working-age center outnumbers the dependent base of young children and the elderly. When you have more people earning and producing than those requiring care, economies typically boom. But there is a biological assumption baked right into that economic math. It assumes that young workers are inherently healthy, physically resilient, and capable of producing at peak efficiency day in and day out. Recent health screenings across the country are challenging that baseline assumption. The Apollo Hospital's Health of the Nation report recently gathered an enormous dataset on the actual physical state of the modern Indian worker. Researchers ran comprehensive preventative health assessments on more than 105,000 adults, and crucially, every single person in this cohort was under 30 years old. If the physiological data contradicts the standard macroeconomic projections, those projections become dangerous. You cannot accurately forecast a nation's output if the labor force itself is wearing down faster than expected. This chart shows clinical results from that under 30 cohort. 52% had abnormal cholesterol, 69% were deficient in vitamin D, and 46% showed signs of pre-hypertension. Looking at the top-line data, over 59% were classified as overweight or obese. The most striking takeaway from the entire study was the self-reported status of the patients. Despite displaying clinical markers for severe chronic disease, the vast majority of these young workers felt perfectly healthy. In medicine, these are called silent risks. They are early biological failures, like plaque thickening an artery or blood pressure rising, that compound over years without triggering a single outward symptom. India is constructing its future economic powerhouse on the backs of a labor force that is, right now, unknowingly compromised from the inside. Having high cholesterol or pre-hypertension in your 20s is a clear biological warning. These are active systemic drivers for non-communicable diseases, conditions like diabetes and cardiovascular disease that require lifelong management. Gastrointestinal surgeons are already tracking the downstream effects of this metabolic environment. The chronic, low-grade inflammation associated with obesity and insulin resistance is strongly linked to a steady rise in early-onset colorectal cancer in adults well under the age of 50. This infographic highlights the current baseline. In 2024, 20.6 million people received a cancer diagnosis globally. According to the World Health Organization, if urgent interventions are not made, those annual cases are projected to nearly double to 35 million by 2050. When these diseases exit the incubation phase and become symptomatic, the immediate workplace consequences are severe. Companies face soaring rates of premature burnout, prolonged chronic sick leave, and highly skilled employees forced into early retirement. At the household level, the damage accelerates. When a primary breadwinner requires long-term specialized care, families are forced to drain their savings and take on crippling debt, removing even more capital from the active economy. A national macroeconomic engine cannot run if its individual parts fail. When the workers themselves degrade decades ahead of schedule, overall productivity flatlines and growth projections become meaningless. The standard healthcare model currently operates as a reactive trap. It waits for a catastrophic event, like a sudden heart attack at age 45, before initiating any serious medical intervention. We cannot solve an impending wave of chronic illness simply by building more hospitals. Constructing enough treatment centers to manage tens of millions of advanced stage patients is mathematically and economically impossible. Even when preventative screenings do happen, they often fall into what doctors call diagnostic voyeurism. This is when a system successfully identifies high-risk markers in a patient, but fails to engineer the actual lifestyle transformations required to fix them. Treating disease only after it has established a foothold acts as a perpetual drain on capital. A strictly reactive healthcare system guarantees that the promised demographic dividend will fail. Healthcare leaders like Dr. Sangita Reddy are pushing for a required systemic alternative, shifting from reactive disease treatment to proactive preventative health screening as a routine annual standard for the workforce. The cost of annual preventative screening is negligible compared to the massive losses from late-stage chronic treatments and lost labor. By catching risks like rising blood pressure early, we can nudge daily habits back to safe ranges long before severe symptoms appear. This requires direct cultural shifts at the corporate level. Employers and policymakers must integrate clear nutrition standards, mandatory physical activity, and active stress management directly into the daily operational structure. India's demographic dividend is a raw resource, not a guaranteed outcome. It is mathematically impossible to achieve that economic boom unless it is deliberately converted into a health dividend first.